I have seen the impact that City Cancer Challenge has had.
It's a very good initiative which holds a lot of promise to change the landscape of cancer care, not just in this city, but across Nigeria as a whole.
SICAN is working with us to develop our solutions.
I know that the City Cancer Challenge Foundation can also help us to build bankable projects.
What was important for us starting off is that we wanted to have a truly holistic picture of what is happening in the city. The point of a needs assessment is that we know that we have problems, right? But what are the most pressing problems and which one of them are the low-hanging fruits? What can we really target immediately?
The needs assessment has been really extraordinary. It's a protocol that if it is well done, the needs assessment will actually get to the root of the problems.
As the lead coordinator for pathology, it's an eye-opening experience for me. It gives you an idea of the kind of records that you should be keeping.
We're all very happy to have, for once, an actual assessment of the needs for cancer treatment.
The non-communicable diseases, they're actually causing more morbidity and mortality in Nigeria today compared to communicable diseases. Then a big chunk of that non-communicable disease is cancer. And we are determined to tackle this.
We have 14 hospitals currently, and in many of these hospitals we have specialists, surgeons, physicians, hematologists, but unfortunately we do not have core oncologists. And also in all these facilities we also lack specialized cancer care center.
Hopefully with some of the funding that's been made available and with partnership with SICAN, we can figure out how to improve financing, because sometimes that's the other challenge.
More than 80% of patients that are treated around here require radiotherapy at some point or the other. But Nigeria as a country, I don't think has ever had up to 20 machines working at the same time.
The challenge we have with the insurance is that most of the chemotherapy drugs are not available at the hospital. So even though you are on insurance and it covers parts of it, you may not find it.
The truth is, for the success of any initiative, you have to get everybody involved. Those are the ones we call stakeholders, to take ownership.
So stakeholders are actually those that plays vital role in terms of access to cancer care services, that ensure that what is discussed today is translated into action.
It makes us to feel like part of the system, which has been lacking for quite some time, and it builds trust, because the cancer patient believes that since they have a representative, that the representative will look out for their welfare.
People are really responding. It's shortening the journey and it's going to make it easier for us to get to the roots and find out what the main problems are.
So we are glad to be fully part of what SICAN is doing and then to give it all the necessary support.
And I expect that at the end of it, we should be able to provide local solutions that work in our local environment. We should also be able to engage the policymakers at the national, state, and local government levels to find solutions towards the management of cancers.
I am very interested in seeing what the outcomes are going to be and how we're going to build from here.
I'm super positive we are going to get things better. Care is going to improve. Patients will become more aware. They are becoming more educated on their disease.
Cancer is thought of as a death sentence in many communities in rural Africa and in particular in Nigeria. We can change that narrative.
This is the time for the challenge that Africa as a continent and Nigeria as a country, the challenge to be faced by all that are on board with regards to managing the disease.